I'm Dr. Saranya. I'm a pediatric dentist practicing in Bangalore. I have done my graduation from Chennai and my post-graduation, that is MDS, from Oxford Dental College, Bangalore. I have my own practice, Krishna Dental Studio in Koramangala, Bangalore, and I'm also associated with multiple clinics and hospital as a consultant pediatric dentist. Children can start brushing their own teeth by around 7 or 8 years of age. Up until then, it is advised that the parents brush their child's teeth and they make sure that every tooth and every nook and corner of the mouth is cleaned out. Even when the child starts brushing on their own, until they reach teenage, it is advised that the parents supervise the brushing or at least stand with them and make it a family activity so the brushing remains supervised, and you can check if every surface or every part of every tooth is being brushed properly. When you come to fluoride, the child can start using a fluoride toothpaste when the child is around 6 years of age. You can move on to an adult toothpaste by using a very less quantity of toothpaste. You can stick to a rice grain sized amount of toothpaste and just smear it on the brush, just enough to lather in the child's mouth. Until the age of 6, there is age appropriate toothpaste that is available, which has lesser amount of fluoride, but fluoride is an essential component of the toothpaste. Sometimes we also advise a medicated toothpaste in case we notice that the child is at a high risk of decay, where we can add on some other elements that will help in remineralizing and adding an extra layer of protection so that the risk of decay comes down. When the teeth are not aligned properly, if we notice that there is no gaps in between teeth, we might also advise flossing in between teeth to make sure that no food gets stuck in between the crowded places of the teeth.